In this video, we will be completing a infirmary discharge. First, you want to search for the patient that you're discharging from the infirmary. And we're going to create an infirmary discharge appointment. So from the patient hub, we're going to click on New Appointment. Our resource is going to be infirmary. Your provider is going to be your infirmary provider. You're going to select infirmary discharge and click OK to create the appointment. Once we create the appointment from the clinical visit console, we'll filter down our facility and our visit type. We're then going to check our patient in. Once our patient is checked in, we'll click on their name to enter the progress note. We are going to complete the infirmary discharge smart form. So at the top of the progress note where it says SF, you're going to click on that and then search and select the infirmary discharge smart form. You're going to document the location where you're seeing the patient, document what their admission date was, and then today's date would be the discharge date. We're going to discharge our patient to general population, and we're going to document what our admitting diagnosis was. You want to document whether it was improved, stable, or resolved. We're going to say that our patient was improved. If there were multiple admitting diagnoses, you will see that there are multiple options to document there. If the patient is going to continue any follow-up treatment or labs or consults or anything like that, we want to make sure that we select yes for those options. And then when we're done completing our documentation, you click Save to save the progress note. If there are any discharge orders for the patient, you are going to refer to workflow 9A for medication orders. Once you're done completing your documentation, you want to lock the note. Always run the clinical rules engine. Be sure to lock the encounter. You're going to return to the clinical visit console, and because the providers are the ones who discharge the patient, we are going to change the status of this encounter to WP. So mark the box next to their name, update the appointment, and change the status to WP so that any notes can be reviewed and transcribed if necessary, and click OK.